Eric Hammer here, registered physiotherapist and owner of Home Comfort Physiotherapy. Today, I'd like to talk a little bit about the idea of referral of pain and different areas that pain can show up, and why it's really important to screen, different areas to make sure where the source of the problem is coming from. But before I continue, please hit that subscribe button below so you'll be notified about any new videos that I have here on my channel. So essentially what I'd like to talk about is this idea about nerves, nerve root impingement, and peripheral nerve irritation. And this concept is based on the idea that in our spine, we have individual vertebrae. In between the vertebrae, we have what's referred to as discs. And coming out of the spine in both the lower back and in the neck area, we have what's referred to as nerve roots, which form peripheral nerves, which essentially run down in the neck area. They run down the arm, and then in the leg, and then from the lower back area, these nerve roots, again, they form peripheral nerves which run down the leg. And one of the largest nerves or peripheral nerves is called your sciatic nerve. So when people are referring to sciatica, in those cases, what they're really talking about is this idea of impingement or compression of the nerve, which is moving along the same pathway as where your sciatic nerve runs through. And so the reason I bring this up is it's going to be really important, before looking at a specific area where somebody might be experiencing pain, such as their hand, their elbow, their shoulder, to essentially make sure that you're clearing the neck area, to make sure that the source of the problem isn't in fact from the neck. And same goes with the leg, So for example, if somebody's having side hip pain or buttock pain, it's going to be really important to make sure that, hey, the source of the problem here is coming from the hip area and not from the lower back. Same with the knee, same with the ankle. And so again, a big part of the screening process, and where it can be frustrating for a lot of patients, is when there might be a discomfort in a certain area which just doesn't seem to be getting better. And perhaps one of the reasons for this, is the fact that the source of the problem is actually coming from, let's say, the neck area versus the localized pain in the elbow, for example. So essentially what I'll have a patient do is go through different positions with their neck where we're repeating these movements, and then what I'm looking for is, hey, are we able to mimic or change the pain that the patient might be coming in for? So for example, if somebody's having pain that might run in the forearm area, so what I might have the patient do is start by doing some neck retractions, bringing the neck back. I might repeat that for 10 times, holding for a second or so. Then I might go into some repeated extension. And again, I'm going to be trying to hold for a good second or so. If that's not making any changes, I might have the patient do some repeated side flexion towards and then away. If that's not doing anything, I might do some rotation. So the idea, is that you go into these different repeated movements. Typically you want to hold for about a second to 2 seconds. We want to try to get to end range with this, and we're trying our best to, again, clear this area here to make sure, hey, the source of the problem is coming, is in this direct area versus something from the neck. In the lower back, again, I might have somebody repeat extensions back, bending forward, lateral shifts of the hip. And basically what I'm trying to do is I'm moving through the lower back, and I'm seeing if any of these specific movements, if they then create that pain, or they might even improve the pain, So for example, somebody who's getting some pain down the arm, let's say an office worker, for example, well, their symptoms might come as a result of potentially prolonged looking down, So if that's the case, somebody who's on the computer a lot, in these forward head postures, maybe looking down, reading a lot, writing, these type of things, if that's the source of the problem, the neck area, if I'm getting the patient, right, to do repeated extensions, they might find, hey, as I'm doing these extensions, my pain's actually getting quite a bit better. So again, I just wanted to go through this concept of making sure that the lower back and the neck are cleared prior to looking directly at the area of pain, in order to make sure that, hey, the source of the problem isn't coming from the spine. If you have any questions or concerns, feel free to leave a comment below, and please check with a physiotherapist to make sure that this or any other information is appropriate for you. And if you or anyone you know could benefit from in-home physiotherapy, please reach out. I do have my links below to set up a time for us to chat. Thanks again, and have a great day. Take care.